Hi guys, so today I'll be talking about a very fairly common mistake which most of the gym goers do, including many people who have been training for years together, is that they start foam rolling their lower back. And foam rolling has now become very common. Foam rollers are available in the gyms. So today I'm going to discuss my reasons, my top 3 reasons, which are based on science why you shouldn't be foam rolling your lower back. So first, let's understand what lower back pain is. So lower back pain is not in itself a disease. It's a symptom which occurs because of other factors, other diseases. One of the most common reasons of having lower back pain is because of muscle imbalances. Like for example, if someone has an anterior pelvic tilt where the pelvis is tilted something like this, which means that your lower back and your hip flexors are overworked and your core and your hip muscles are underworked. So what is a foam rolling? Foam rolling is a self myofascial release technique which has become very popular these days in the gyms to use in situation like injuries and in like acute muscle pains. Reason why you shouldn't be foam rolling your lower back is because you already have something called lumbar lordosis. This is like the curvature of this lower back. So when you're putting a foam roller over here and you are rolling your lower back, you are putting your back into more lordosis. That's why people who have things like stenosis or a stretch fracture or a lumbar disc bulge or disc protrusion, disc herniation, it can exaggerate those conditions and not alleviate the pain in long term. So the second reason is if your pain is caused by non-mechanical factors like arthritis or spondyloarthritis. What happens in that is if you are putting an external pressure on your lower back, it can exaggerate those conditions. So it's not recommended if you don't have a diagnosis of your chronic lower back pain, it's not recommended to foam roll over those areas. So the third reason is that the areas which you foam roll, suppose you're foam rolling your thoracic spine or your chest, so the organs beneath it, the lungs and the heart beneath is protected by that bony cage. Here, you don't have any bony cage. So you don't have ribs over here. You just have your lumbar spine. And you have organs like kidney over here and liver over here, which might get damaged if you are not well controlled in that motion. So try to focus on the root cause of it. Try to focus especially on your muscle imbalances. If you don't know why it's causing lower back pain, visit your orthopedic doctor. He will be able to diagnose it if you have a serious condition or it's just a sprain, and then advise you, physiotherapy based on that.